you for taking the time out of your busy day to be with us today and learn more about reproductive health. More importantly, I hope you brought along friends who are not yet passionate supporters of reproductive health, because what we really need are people who will understand this bill and be able to explain this to others. So let me proceed. I just simply like to start with the premise of the reproductive health being a guaranteed right. As I said, Senator Miriam will go through that, but it is important to note that reproductive health is a right guaranteed not just by, not just under our Constitution, although our Constitution does not specifically speak of reproductive rights of adolescents, because God forbid that they talk about these things in the constitutional conventions or even on the Senate floor. Medyo allergic ko ang mga tao kung ganyan ka-specific ang details. But I think this crowd is mature enough for me to use these words. Is that something I can assume? Yes. That I am talking to a mature crowd who will allow me to use the words as adolescent reproductive and sexual health? Can I say that? Because when I talk about this in the Senate, my staff wink at me and say, baka hindi matake yan ng ibang mga kasama namin doon. So I hope I don't have to look at my staff for them to give me signals to tone down my language. And to think hindi naman ho ako gumagamit ng bad words, no? So anyway, the International Conference on Population and Development have a program of actions wherein, and I won't go into the fine detail, but they basically recognize that the adolescent sexual and reproductive health issues include unwanted pregnancies, include the transmission of diseases, and require that we address these issues by programs that provide them with education and awareness. And I'll go through that in a little more detail. I just want to recognize that these conventions and international statements do exist. There is, of course, the United Nations Conventions on the Right of the Child, wherein specifically adolescents are entitled to rights under the convention, and these specifically include the right to the highest attainable standards of health, including the right to reproductive health, the right to impart and receive information, and the right to education, including complete and correct information about sexual and reproductive health. And then we also have various other conferences, the International Conference on Population and Development, the UN Conference in Cairo, and these are programs and conferences that we make reference to when we try to explain the significance of the bill. Now, the difficulty with making references to these international conferences is that it then brings about the big fear that we are now being dictated upon by foreigners on our reproductive health policy. So let me ask you, are we prepared, are we mature enough, are we intelligent enough to have our own reproductive health policies? Do we need to be dictated upon? I don't think so, but we make reference to this because the fact is we have signed and we are committed to these international conferences. So it is a fact, but the challenge still remains if we have the ability to pass these laws. So we do have our Constitution, which basically guarantees the right to health, and as I said, it's very general, but from here, we have put in specific provisions. Well, anyway, I won't go through it. Many of you are law students, and you can easily access these constitutional provisions on the right to health and the need to provide services, and including free services for those who can't afford. Now, what happens is we go straight to the Senate bill. In our Senate bill, well, obviously it is our reproductive health bill, but we have specific measures wherein we talk about sex education for the youth. Now, that topic has not been debated on in the Senate, and that I do know is a sensitive issue for some of my colleagues, and some of them there have been a lot of opinions raised on why this should be included and why it should not. But before I go very specifically to that, I just need to, I want to take advantage and share with you a few salient points of the bill, since I am fortunate enough to have an intelligent crowd with me this morning. Sorry for the overemphasis, it's my frustration. Anyway, I always like to start with what the bill is not about, so if you can just return that slide. This is how I started my sponsorship speech in the Senate. And number one, I had to assure everyone that this bill is not about legalizing abortion. On the contrary, it protects the mother and the child. And in fact, during the debates, no less than the Senate President, who has clearly expressed his opposition to the bill, said that we have been very successful, and I congratulate my colleague. We have been very successful because the way, he says that the way we have framed the bill, specifically with the provisions that contraceptives will be provided, there will no longer be a need for abortion because we will be successful in making contraceptives legally and safe contraceptives available. So I said, wow, that's wonderful, because if the main oppositor of the bill can recognize that fact, then we have achieved our goal. Because that is what we want, for legally safe contraceptives to take the place of abortion, is that not? Because there are about the estimate is 500,000 abortions every year. So that is what we're trying to do. We do not want abortions. There is a lot of abortions happening, and we are not legalizing it. We are providing women with the alternatives. It is also not a bill that imposes one family planning method on any single family. So contrary, to differentiate this from a population program, which again is the fear of many oppositors of the RH bill, what this bill does, it provides women and families with information so that they can make their own plan. They can decide on their population of their family. It is not state imposed, so there is a big, big difference. Now, if the ultimate result is that every family will have one or two or three less children, well then it would have a macro effect of lowering the population of the Philippines. But then it is done on a family level. And there's a huge difference between a state-imposed population program and a family, well-thought-out plan as to how many children one should have. And I always like to say it will not solve all problems, because they always throw it back at us. Well, why don't you focus on dengue? Well, why don't you focus on TB? Well, why don't you focus on the economy? Well, we have different Senate committees who do all that. And in the Senate Committee on Health, I do look into all the other health issues. So this is not going to solve all the problems, but it will probably solve some. And this brings me back to our youth and adolescent. This will not teach a 9-year-old how to use a condom. That is the debate that they keep bringing up, and the fear is that it will promote promiscuity among the youth. So what we aim to do is save the lives of mothers, provide Filipinos with information on their reproductive health, and provide Filipinos with access to healthcare facilities and skilled health professionals. So this is the first forum where I will actually dissect this provision and explain that when we say provide Filipinos with information, the objective really is to provide all Filipinos. But can I say in the bill that this includes adolescents and youth? No, I cannot say that, because people are not many people, particularly those who I work with, are not ready to hear that adolescents need to receive information about their reproductive health. What is reproductive health? Let me go into the meat of this issue. Reproductive health for adolescents is not simply the need to address unwanted pregnancies and STIs. The mature crowd can understand that, yes, that is an issue, is it not? Do I need to prove to you that there are teen pregnancies? Do I need to show you how many 15-year-olds are now mothers? How many 16 and 17-year-olds in this country are carrying their second baby? How many of them are unwed mothers? How many of them are trafficked victims? I won't give you the statistics because I don't memorize them, because they are even too gory for me to know. I know it's there, and I can give you the statistics at the appropriate time for those who want, but they exist. And we are blind, and we are stupid, and we are ignorant if we refuse to acknowledge these facts, or if we choose to acknowledge them but refuse to do anything about them. So these teenagers have reproductive and sexual health issues. Many of them are raped by their own families, by their own fathers. We live in a country where 10% of our population are OFWs. So many homes are motherless. And many, and again, because of the lack of statistics, I cannot tell you the exact number, but there are a huge number of young girls right now who are not only the ates of the families, but they are now substitute spouses of their absentee mothers. And this goes on in many homes where there is no mother. So there are reproductive health issues because number one, what is her issue? What is the issue of a young girl who is raped by her father? Is it, wag ako mabuntis? Or is it, bakit ako nire-rape ng tatay ko? What is the more important issue? Or is it, baka mabigyan ako ng STI ng tatay ko kasi may girlfriend din siya? Which is the issue? They're all issues, aren't they? But none of these issues can openly discussed. They cannot be in this society. When the Department of Education came up with a program, and I laud them for their bravery in doing so, they came up with an adolescent and youth program. It was shut down because of the pressures of certain groups. Are any of those groups here today? Those are the realities, my friends, my students, my teachers. What do we do with this? Will we continue to close our eyes to these prevailing issues? Do Senator Miriam and I tiptoe around this issue para lang mapasa yung batas na to? And let's pretend that 18-year-olds and below do not have reproductive and health issues. Because if we take it up, then they will try to block the bill further or talagang hindi papasa ang bill. What is our choice? What do we do? So do I just continue to have generic provisions there and hope to God that this administration will take notice of this issue and do something about it? Because that is, in fact, my intention. The provisions are clear enough. It gives them enough mandate to take action. So let me move along. Well, these are statistics, and like I said, I will not, give you all the statistics, but basically the figure that I do remember is that 23% of our youth, and that is described as 15 to 27, are sexually active. And if you will assume that most of them have no information or very little information, then you can just imagine not just the unwanted pregnancies, the unwanted sexually transmitted infections, but also all the emotional, psychological, sociological problems that come with it. Because as I started out, I said, well, let me quickly go through these studies. The UP Population Institute says many young people engage in risky sexual behavior. Their knowledge of reproductive health is inadequate. They rarely seek medical help, and they do have liberal views on sex and related matters. So as I was saying, reproductive and sexual health are not limited to not getting pregnant and not getting an STI. If you think about it, the reproductive health issue starts probably at 9, at 10, at puberty, when their bodies change. All of us here are over 9, 10, 11. So not all of us know that there were questions that were raised. And what if you don't have a responsible, or you do have a responsible but an uncomfortable parent to talk about these things? Who talks to you about these things? You've heard these stories where kids, and this is on the extreme side, but want to commit suicide because suddenly they're bleeding and they think they're going to die, or something about their private part is changing, and they were told that is a monstrosity. So this is information. And during the Senate, my sponsorship, I said, what do we tell a child when their mother's stomach starts to grow? I definitely heard people when I was a young kid telling me, nakalunod ng basketball ang tita mo, or may lobo sa loob niyan. So is that what we want our children to know? And I'm a very big fan of Philippine history and mythology. I love Philippine mythology. Pero talaga bang kay malakas at maganda tayo nang galing? Yan ba bit-bit natin when we attend our international conferences? I mean, seriously. We should be able to distinguish between myths and facts. And if we do not want to talk to our children about this, who will? It will be the internet. It will be the posters of bench, of, ano pa ba? Ano pa ba yung nandun? those are the messages that our children will receive, no? But going back to reproductive health, beyond, as I was saying, beyond unwanted pregnancies and unwanted sexually transmitted diseases, reproductive health is also about understanding your body and developing a wholesome image about your body, is it not? It is also about developing a positive self-image. You hear all these stories about young girls becoming anorexic, young boys raping young girls. All of that has to do with their self-image, of who they are, of what they are, of what their bodies are meant to function for. But we do not talk about these things. And last but not the least, reproductive health is very directly related to the ability of forming wholesome and healthy, lasting personal relationships. I mean, at some point, God forbid, we will have sex, right? I mean, Senator Miriam is my idol because she's the only one who can talk about sex on the Senate floor. And I said, I was a new senator in 2004. It was like the first 3 months in the Senate, and Senator Biazon, the original proponent in the Senate of reproductive health, delivered a privileged speech on reproductive health. And Senator Miriam stood up and said something to the effect that, God forbid, if I could only have sex with my husband to procreate, I would have left him years ago. And I was dumbstruck. I said, that's my woman. I want to be able to say that one day. So now at least I was able to say it in the Malcolm Theater. Well, maybe it'll take me another 3 years to say that on the Senate floor. But that's what it is, right? I mean, the next controversial bill that I hope to sponsor with Senator Miriam, unless she leaves us for international challenges, is the divorce law. And there will be many more interesting stories to tell then. So I'm just warming up, to get used to talking about these things. Just because, if I have a crowd that reacts as enthusiastically as you, then it wouldn't be a problem. But believe me, in the Senate, it's dead silence. So, but anyway, I mean, again, like I said, one day we all will have sex. And one day, we do hope to have a wholesome, happy, harmonious, sexual, and personal relationship, right? And the reason I mentioned the divorce law is because we do know that it is a fact that many marriages do not work out in this country and many countries. And I would think that a lot of it has to do with the lack of preparation when you enter into this very strong, supposed to be forever after relationship. So I think that these are issues that relate to reproductive and sexual health. And I think I've made my case, right? That adolescent sexual health is a necessary component of reproductive health. I mean, my staff has provided us with more details, but basically this is the bill that says that age and development appropriate reproductive health education will be provided, and we tried to be very politically correct, in the terminology we use, because it is a sensitive topic, and we are aware of that. But we did try to be very specific so that we address issues such as gender-based violence, teen pregnancy. I specifically included responsible teenage behavior. And we also have a provision where we ask the state to provide parents with information, because what the opposers of RH bill say is that it is primarily a responsibility of the parents to teach their children. And I agree with that. But what do you do when parents either have no knowledge or have knowledge but are very uncomfortable? I have friends, UP graduates, honors graduate pa, and they'll say to me, Pia, paano mo kinuwento sa anak mo yung, how do you talk about sex with your kids. And I'm like, oh sige, ganito gawin mo, ganito. It's just that I grew up with an educator. My mom is not only an educator, but she's American and she's very comfortable talking about these things. So I also am. And I know it is not easy, but it is what it is. So we need to also educate our parents on how to provide this kind of information to their children, because if not, no, and that is an issue that I will have to deal with when some of the senators, if they decide to take it up. If we are silent on this, and if we don't also educate parents, you know what I hear more from parents? And I'm sure you've seen this yourself on TV, in the news, and me, I've heard it from my friends. They'll say to their young teenage son, anak, tirahin mo na yan. I'm serious. A friend of mine had like a 14-year-old, and he said, oh no, anak, tirahin mo na yan. What does that mean? What does that mean? What kind of message does this father send to this son, 14-year-old son, when he says that? And then you have them saying an exactly different thing to their daughter. Do they ever tell their daughter, Iha, tirahin mo yan? I should say that to my daughters. By the way, just a plug, because I'm so proud of my UP education. My daughter was studying for a social science exam 2 nights ago, specifically political science. And my kids know that I come home from an RH debate every night, and my 16-year-old daughter said to me, Mom, the rights of the minority are essential to every democracy. Please tell that to the RH opposers. So anyway, I'm saying that it just so happens that my children live and breathe these issues. And I'm not saying that every child should live and breathe these issues, but they should have at least a basic knowledge of what the reproductive health and sexual health rights are. So I think I can leave it at that, because I think more importantly is the open forum portion. So Senator Miriam can give you the meat of the reproductive health issue, and then we can answer your questions. Let me briefly leave you with some ideas to ponder on, because I would love to hear from you later on. This is actually a fact sheet prepared by the National Center for Children in Poverty from Columbia University. And they talk about sexual and reproductive health rights of children. And I just want to quickly go through some of the recommendations, some of which I believe are consistent with what we are trying to do. And some of them, I want to ask your opinion if you think we are ready for this, and if you think it is consistent with our Philippine culture. So one recommendation is the funding of positive youth development and after-school programs. Basically because studies show that high-quality after-school programs are very effective in delaying the onset of teenage sexual behavior. So I think that's basic, no? Despite the fact that a lot of people refuse to acknowledge that teenagers have sexual thoughts and have tendencies to display sexual behaviors, the fact is we need programs to address this. Next is funding programs that bring services to the youth who are disconnected from school. And that's a big problem in our country. No? This was prepared for a developed country, but I think more so in our country, where a lot of these kids, if there were programs in the schools, which as I told you, DepEd attempted to do, would not reach them because they are out of school. And the other one is, this is a very good one, and this is where I challenge the youth. Support programs that educate and empower young people as peer educators and advocates. Again, studies show that the youth is more receptive when their leaders are their peers. So this is where I challenge the youth to, I'd like to think that I'm still part of it, no? But I actually have a 16-year-old, so I don't think she really thinks I'm her barkada. So the challenge will be upon you to develop these kind of programs. And then this is the interesting one. And I will look to my co-sponsor and ask her what she thinks. Pass legislation to enhance confidential protection to improve adolescents' access to confidential services. So this is actually speaking of the rights of adolescents to go to clinics and to ask for advice. Now, I know for a fact, some of our colleagues said, bakit? Bibigyan ba ng condom ang mga teenager? Hindi na lang ako sasagot, no? Because sa klaseng tanong pa lang na yun, I guess the answer is supposed to be, God forbid, no way, no? Because the objective here is to provide them with access to information and services. Now, I go on to the next recommendation, which is directly related to the previous one. Make contraceptives widely available in venues frequented by adolescents, including schools. Now, we all know, intelligent people know, that the objective of this measure is to ensure that if, and that is, I think, the operative word, if they decide to engage in sexual behavior, then they can be safe. Now, does making it available make them promiscuous? Do I walk by a condom when I was 16 or 18 and I did go to the United States and see a condom machine? Did I walk by and suddenly say, hi, I think I will have sex. There's a condom machine beside me. Did I? I did not. Just to let you know, I was an adult when I had sex. So that's it. No? And I admit, these are controversial and now is not the time for us to debate this. But these are issues that we should be mature enough to discuss. That is the least that I think we can ask for. So I leave you with those thoughts, and even though we only have a few hours, feel free to email me. Senator Miriam and I are both on Twitter, and we also are daily in the Senate working on this bill. And let me take this opportunity to thank every one of you for spending the time here today to learn more about the reproductive health bill. Thank you very much.